Hey everyone, welcome back to Graft Academy. Today we're talking about a topic that confuses almost everyone at first, the cost of a dental bone graft and what you're really paying for. You might have seen numbers online ranging anywhere from a few $100s to several thousand, and it can be hard to understand why. Let's break it down clearly and realistically. A bone graft is not a one-size-fits-all procedure. The cost depends on several key factors: the type of graft material used, the size and location of the graft, the complexity of the surgery, and whether the graft is done at the same time as another procedure, like an implant or extraction. Let's start with small socket grafts, which are the most common. These are placed immediately after a tooth extraction to preserve bone and prepare for a future implant. A typical socket graft may cost between $300 and $600 per site. This usually includes the graft material, the surgical placement, and the follow-up visit to check healing. Next are larger ridge augmentations, grafts used when a significant amount of bone has been lost and needs to be rebuilt before implant placement. Because these require more material, time, and skill, they often range from $800 to $1,500 per site. Then there are complex grafts, such as block grafts or sinus lifts. These involve advanced techniques and sometimes bone harvested from another area of your body. Costs for these procedures can range from $1,500 to $3,500 or more, depending on the complexity and materials used. Now let's look at what's actually included in that cost. When you pay for a bone graft, you're covering the surgical time, the materials themselves, the membranes that protect the graft, and the post-operative care. You're also paying for the expertise of the surgeon or implant dentist. Their skill directly affects how well the graft heals and how long it lasts. The graft material itself is a big part of the cost. Processed human or bovine bone, synthetic minerals, and resorbable membranes are all carefully sterilized and designed for medical use. These materials are expensive because they're tested for safety and biocompatibility to ensure predictable healing. Another factor is technology. Offices that use 3D imaging, PRF processing, or digital planning may charge slightly more. But these technologies greatly increase accuracy and success rates. You're not just paying for the procedure, you're paying for precision, comfort, and predictability. It's also important to note that a bone graft can save you money in the long run. By preserving or rebuilding bone now, you prevent the need for more invasive and expensive procedures later. Without a graft, bone loss can make future implants impossible or require complex reconstruction that costs much more down the road. Dental insurance coverage for bone grafts varies widely. Some plans cover grafting when it's medically necessary, for example, to preserve bone after extraction, while others classify it as part of implant treatment and exclude it. Always check with your dentist's office for a pre-authorization estimate before treatment. To sum it up, a small graft may cost a few $100s. Larger or more complex grafts may range into the low thousands. The price depends on material, complexity, and technology. But what you're really paying for is lasting bone stability and long-term oral health. When done correctly, a bone graft is an investment in your foundation. It's what allows implants to succeed and your smile to stay strong for decades. If you found this video helpful, make sure to like it, subscribe to Graft Academy, and share it with someone researching bone grafting or dental implants. We post new educational videos every week to help you understand modern dentistry in simple, clear language. Thanks for watching, and we'll see you in the next episode.